lot of numbers bandied about tonight, and a lot of discussion about the numbers. Could you tell me what those figures mean? Is that the percentage of people who rate the hospital experience as excellent? Could you clarify that for me? Is that the number?
So you're asking me about patient satisfaction right now?
Mm-hmm.
Yes.
There's a lot of numbers.
Yes.
Mm-hmm.
Yeah.
That's the percentage of people who describe the hospital experience as excellent.
Excellent, right.
Okay.
Yeah, on patient satisfaction, it's only, that's the number we look at is the top box number.
Okay, and I'm just wondering why those particular numbers. There's a certain percentage here or there, and I've got the numbers written down here. Shouldn't we be trying for like 100%? If you could just explain that, it sounds like a
Right.
simple question.
Okay. So I want to be sure, because the numbers that you may have written down that were on that chart,
Mm-hmm.
those are employee engagement numbers, not patient satisfaction numbers. Two different things. Okay. So, but I will speak to the patient satisfaction number. Yes, 100% is the ultimate target. You want 100% of your patients and their families to rate you as excellent. So, if I had a long-term, where's the ultimate target? It's to get to 100. Right now, the reality is we're sitting at just around 44% of the time people tell us we're excellent. And we want to move that to 47 this year, which would put us amongst some of the best in the province already.
That's patients or employees?
That's patients. Patient satisfaction, ranking it as excellent.
And we're currently at how?
At just shy of 44.
Okay. And we want to get up to?
This current year would be up to 47, and then we'll continue to improve it past that.
That's the patient experience.
That's the patient experience. On the employee experience and the physician experience, our target there is by 2017-18 to achieve the best quartile of Ontario hospitals. And past that would be the best decile of Ontario hospitals. Right now, we sit at about the midpoint of Ontario hospitals.
Ron, why are the targets being lowered for satisfaction? They were lowered by about 2%. A lot of the discussion centered around why that is, and there was some reservation about that decision moving forward.
Well, as I said, the main reason for it was to factor in where we're starting from. Right? When we originally established these targets, we didn't have a final number for the previous year. So that's the main reason for it, is to still have very aggressive targets and realistic targets that we will drive towards and work off of that.
And you still have those for 2017-18. You left those constant, but that number is subject to change.
Well, the raw number would change, but our drive and our goal for 2017-18 is to achieve best quartile performance. So regardless of what the number is, that's what we're measured against. Have we achieved best quartile performance?
So lowering those targets does not necessarily mean that there will be any less of a desire to achieve said target or higher.
No. The improvement for this year is still pretty significant and requires pretty significant effort.
So is this just a situation where this just continues to be monitored and you just progress towards?
Yeah, we're continuously monitoring our metrics as an organization and picking those that are the most relevant for where we are and where we need to be going. And we're an organization that measures our results. So that's what we keep doing.
So what specifically are you looking for to help make those numbers reachable?
Well, it changes depending on which areas we're talking about. Excuse me, but
You had said that you're not letting off on the pedal, but you're pressing in other areas.
Right. So around patient satisfaction, it's learning from our high performing areas, applying that into some of our areas that need more help. It's making sure that we do a better job of communicating when people are being admitted to hospital, what their stay is for, how long it's going to be, what the plan of care is for them. So many questions, being able to provide the answers to those for our families and their patients while they're here. On the physician engagement and employee engagement piece, it's again doing a better job of making sure people are involved in the decisions that impact them.
So how do you make a question more specific? That was something one of the board members brought up. I guess when it comes to patient satisfaction or having that as part of that process.
Sorry, Jason, I'm not.
One of the board members had talked about should the questions be more clear in order to.
Oh, okay, yes. The survey instrument that we use in both cases is the same one that's used across the entire province. And that question was, in particular to physicians and making sure there's more clarity around when we ask about satisfaction with going to work, whether it's at the hospital or in general. And that's definitely something we can provide as feedback to our vendor. We'll leave it with them to ultimately make the decision, but I think it was good feedback to have.
There were some other questions from board members about certain categories and their involvement in the final numbers, like mental health and other departments like that. But you had said that they're part of the yearly results or the annual results.
Well, there are some departments, like anything else.
Would those not be highlighted? Is what I'm trying to ask individually.
In mental health, as an example, the amount of feedback that we receive from our patients is very, very low, to the point where if you were trying to use that as a statistically valid number, it wouldn't hold weight. And that's why we don't report it in that specific area.
So I guess with some of the results not available until June, I think was announced, would that not be more, I guess, would a more frequent period be ideal here?
Well, ideally, you always want the most recent information. We had a challenge in the first part of the year. I don't expect that will be repeated with our existing vendor, and we'll have more current data on that. And even in other areas where right now when they get annual information, we're looking for ways to get monthly or quarterly information that we can manage from in a better way. So staff engagement, physician engagement would be two examples of that.